is that last half of the year, I calculate about 9.1, let's call it 9 million in revenue. Is that kind of indicative of how, I am not asking you to give a projection, but is that kind of indicative of how the growth looks like already for the next fiscal year?
That's correct. I mean, you have to look back to, there's always reasons for that revenue growth. And when you look back to it, basically we have three key products. Currently we commercialize about 8 products that are in various therapeutic areas, but there's three of them are the real big revenue drivers for the short to medium term. That's Redesca, our anticoagulant, which is a hospital-based product, and our
blood thinner, to speak
blood
English.
thinner, and our more recent launches, which are 2 innovative asthma products that are tremendous improvement in asthma care in Canada. Well, Redesca was launched really at the beginning of the third quarter. So the first half of the year had almost no revenue from these new products. Redesca launched last week of April, certainly contributed to the third quarter and again in the fourth. When you look at our 2 asthma therapies, we only put our team together, and we have a team on asthma that's over 60 people in the field, actually in front-facing physicians and nurses and pharmacists. And that really started in September. So we really had 2 months of early day kind of minor sales. So Redesca drove most of that revenue. So that 9 million, when you look at it, it was on the backs predominantly of Redesca and obviously our existing portfolio. But the growth from continued growth from Redesca and from our asthma therapies, we're starting to see it again, continuing in the first quarter. That's why we're saying sequentially in the press release we put out earlier this week, we expect sequential quarterly growth and significant sequential quarterly growth. And
yeah, because these came into your pipeline in stages over 2021.
That's correct.
If you love that clip, give us a like, then hit the link to watch the full video. Don't forget to subscribe.